viewers, welcome today on DDM Health News Update. On our program, your health, your wealth. But as a reminder, friends, don't forget to subscribe to our YouTube channel, that is Diaspora Digital Media, so that you can be getting the latest information on health. Wow, back to details. Vice President Kashim Shettima has made a passionate call for a collaborative effort among stakeholders to rescue Nigeria's ailing healthcare sector, stressing that the task of national development cannot be left solely in the hands of government. Shettima, who made the call at the weekend during the commissioning of the newly built Suleiman Adebola Adegunwa Trauma Center at the Olabisi Onabanjo University Teaching Hospital, that is the OOUTH, Sagamu, Ogun State. He urged Nigerians, including philanthropists, foundations, and private sector players, to contribute actively to the health sector's growth. Our historical struggle to fix the healthcare system must be undertaken collectively through synergy between the public and private sectors. We are a nation of immense promise, but also of immense problems. This is why the government alone cannot shoulder these challenges, he stated. The Trauma Center, a 50-bed facility fully equipped with state-of-the-art technology, was donated to the institution by billionaire industrialist and chairman of Rights Foods Limited, Otumba Suleiman Adebola Adegunwa, through his foundation in his celebration of his 80th birthday. Describing the facility as timely and strategic, Shettima said the trauma center would significantly boost our emergency medical response, especially in an era of rapid urbanization and increasing accident rates across the country. We need more private sector players and philanthropists like Otumba Agunwa to rise beyond personal achievement and actively participate in national development, the Vice President added. He said the establishment of such a facility aligns with President Bola Ahmed Tinubu's renewed hope agenda, which seeks to prioritize healthcare and deliver timely intervention to Nigerians, especially victims of accidents and trauma. Ogun State's Governor Prince Dapo Abiodun, while commending the initiative, said the location of the center was strategic, given its proximity to two of Nigeria's busiest highways, that is the Lagos-Ibadan Expressway and the Sagamu-Benin Expressway. Now, emergency cases, especially road traffic accidents, can receive swift and expert intervention. This facility will play a vital role in saving lives, he stated. The governor reiterated his administration's commitment to affordable and quality healthcare, adding that the trauma center represents a bold step in strengthening the state's medical infrastructure. On his part, the donor, Otumba Adegunwa, expressed hope that the trauma center would serve as a beacon of healing and hope for those in distress. It is my sincere wish that this center becomes a sanctuary for victims of life-threatening injuries and sudden medical emergencies, he said. Adegunwa revealed that the inspiration came after a previous donation of an audiovisual center in the same institution in 1995, which he said was well maintained and effectively used. The new trauma center featured 3 surgical suites, a modern ICU, a high dependency unit, an elevator system for patient transfers, and advanced diagnostic imaging technology. Next, stakeholders in the healthcare and education sectors have raised serious concerns over the persistent neglect and lack of infrastructure for children living with special needs across the country. They made the call at a press briefing held in Lagos and organized by Our Consult Disabilities Outreach, where the organization unveiled plans for for a groundbreaking world-class facility to cater the needs of children with disabilities in Nigeria. Speaking during the event, the Chief Responsibility Officer of our Consult Project Coordinator of the proposed center, Mrs. Olufuke Adeloye, lamented the critical infrastructural gap affecting children with disabilities, saying Nigeria has failed to fully implement inclusive policies despite signing international treaties. We have the policies in place. There are laws on inclusive education and healthcare, but the reality is that there is little or no infrastructure to back them. Implementation is our biggest problem, she stated. Adeloye decried the deplorable state of healthcare facilities across the country, especially in public and teaching hospitals, where basic amenities such as water are often unavailable. Yes, in some hospitals, families are asked to bring their own water during childbirth. You can imagine that. How do we even begin to talk about care for children with special needs when basic facilities are not yet in place? She also condemned the poor state of public schools, saying many lack essential structures such as wheelchair ramps, specialized staffs, and therapy services, making it difficult for children with disabilities to learn in a conducive environment. It's disturbing that many schools in Nigeria still operate without the minimal requirements needed for inclusive education. A child in a wheelchair cannot attend school if there are no ramps or elevators, she added. Adeloye, however, expressed optimism as she unveiled plans for ARC Center Prime, a state-of-the-art special needs facilities to be located on a 35-acre site in Olu near Ogbomoso, Oyo State. According to her, the center built to begin construction on April 22nd, 2025. It will provide healthcare, education, therapy, respite care, and other support services for children and young people with disabilities aged 0 to 25 years. Highlights of the center's features include residential accommodation, a specialized hospital, daycare, therapeutic and recreational facilities like a water park, nature garden, and botanical space. The center will also house a chapel, sports complex, advisory services for families, and even a farm for hands-on skill development. This will be the first of its kind in Nigeria. Wow! Our goal is to provide the kind of care that families currently travel abroad for. With ARC Center Prime, we are beginning world-class disability care home, she said. Adeloye noted that the facility would be sustained through a hybrid model combining payments from families who cannot afford it, international grants, and volunteer inputs from professionals. She described the project as divinely inspired and destined to succeed. We believe this is not just a human initiative, it is what God wants to do in this time. And when God is behind something, nothing can stop it, she added. Also speaking at the event, the Asipa of Odiolowu in Mushin Kingdom, Prince Deji Irawo, who serves as an advisory member of our Consult, underscored the need for joint effort to tackle the challenges faced by the children with disabilities. He called on government agencies, philanthropists, professionals, the diaspora, and traditional rulers to rally around the initiative to ensure its success. As traditional rulers, we have a duty to advocate, create awareness, and mobilize both local and global support for these children. They are special and they deserve to be treated as such, he added. Irawo added that traditional institutions can play a pivotal role in changing the narrative around disability in Nigeria, emphasizing the need for compassion, care, and collaboration. Founded in 2021, our consortium operates in Nigeria and the United Kingdom, offering specialized education, skill-building programs, and advocacy aimed at bridging the disability care gap in Nigeria. Up next, a group of retired nurses under the banner of Retired Nurse Administrators Healthcare Initiative, that is the RNAHI, has advised nursing mothers across the country to adopt health lifestyles and avoid self-medication after childbirth, warning that poor health-seeking behavioral child could jeopardize the lives of both mothers and newborns. The caution was made or issued on Monday during a health sensitization program held at the Isolu General Hospital, Lagos, as part of activities marking the 2025 edition of World Health Day, themed Healthy Beginnings, Hopeful Futures. Speaking at the event, President of RNAHI, Mrs. Olufunke Taiwo, emphasized that building healthy families and communities must begin with a deliberate focus on maternity and child health. She further explained that the initiative aims to curb rising cases of maternal and infant mortality, particularly by enlightening women on the dangers of shortcuts in healthcare and the need for responsible health practices. Yes, according to her, we want to create awareness, especially around maternal and child health. We want to show women where and how to seek help when they encounter health challenges. If we are healthy today and remain healthy by knowing what to do, then our future will be better. Or don't you think so? Well, Mrs. Taiwo further stated that the economic hardship in the country has forced many women to seek alternative and sometimes dangerous means of care, including the use of unverified herbal concoctions and over-the-counter drugs without proper prescriptions from the specialists. Collaborating her position, chairperson of RNAHI Group 1 project, Mrs. Olumilayo Akinwande, said the campaign was designed to educate mothers on healthy postnatal practices and proper care of their newborns. We are here to sensitize them on how to care for themselves after childbirth and how to properly care for their newborns. This includes encouraging immunization, which remains crucial. Yes, some people still believe that immunization causes polio and other ailments due to lingering myths. We are working hard to change that narrative through consistent education, she said. She also added that RNAHI is working in collaboration with the hospital to promote better health outcomes among nursing mothers. Health is wealth. If you have all the money and lack good health, you will end up spending everything on treatment. That is why awareness is the key. On her part, the immediate past president of RNAHI, Mrs. Abodese Olurantebe, appealed to well-meaning Nigerians, philanthropists, and corporate organizations to support government's efforts in improving healthcare delivery. We need God-fearing individuals and corporate bodies to come in and assist. The government cannot do it alone, and international donors are no longer as active as they used to be. If more hands are on deck, we can make quality healthcare accessible and affordable, she stated. Other notable members of the RNAHI group are projective present at the event, which include Mrs. Olurotoyin Bello, Mrs. Kafayat Idowu, Mrs. Olaide Animashun, Mrs. Remi Kole, Mrs. Omalabeki Akimbote, M.I. Akimuleya, and Mrs. Ayodele Abike. World Health Day is celebrated globally on April 7th every year to raise awareness about pressing health issues and to encourage actions that promote better living. Well, listeners, this will be all for now on Your Health, Your Wealth. Remember, your health is your wealth. Well, do not forget to click on the like button, share, comment, and subscribe to our YouTube channel, Dial Digital Media, for more latest news updates. Until next time, I remain your host, Nenyere Michael Inezine. Bye for now.